Hey, Dr. Conley here. I want to address the term denial and the way that it is used in the field of substance use treatment. Denial often implies that a client knows what the truth is, but they're denying it. Denying is what we do when we're accused of something. I accuse you of this. I deny that I did it. That kind of thing. Um, the assumption in the history of substance use treatment was that people did know the truth and were denying it and needed to be confronted with the truth so that we could break through the denial and bring them into the truth of the reality of their use. That model didn't work. More about that in a second. The model came out of Hazelden Foundation in Minnesota. It's also called the Minnesota model, breaking through denial, confronting clients, bringing them into the reality of their use. In truth, I think people with substance use disorders are often delusional to some degree when it comes to their substance use. They believe that, that their use is not killing them, that it's not causing the problems, that it didn't really impact their relationships around them. They don't know the truth about this. They need to come to their own truth. With the old denial Minnesota model, you would break through somebody's denial. They would actually see the truth as you and everybody else in their life saw it. We would have an intervention, bring in the family, and it's like, whoa, this must be what's true because everybody thinks it is. They would jump into that reality for a while, but it wasn't their reality. They didn't arrive at it themselves. They weren't empowered to get in touch with their own truth. And it would fade. Their insight would fade and relapse would follow. And it's like, well, you seem to know the truth and you went back into denial. Let's look at it a different way. To encourage a client to be able to see what's really going on with their substance use, we use motivational interviewing, and that's the newer model. And we use that as an entry into other models of treatment, cognitive behavioral therapy, 12-step facilitation therapy. But MI encourages a client to see things for themselves. What really is going on with your substance use and how is this affecting you? Is it getting you what you want? So it's a different kind of approach to try to get the client to the same place, which is into the reality of what the substance is doing to them in their life. But it doesn't rely on confrontation. So be aware when you're in the field of substance use treatment and addiction treatment, how that term's being used, because you will hear it. And if it's used with an understanding that the client does not know the truth and needs to be gently led to that, it's fine. If it's used as a way of basically calling clients liars, don't go with that. It's not what we want to do. It's like, the truth, you're just denying it. Now there's a line there. Some clients do know, they lie about everything. But with the person with an SUD, it generally, their delusion is limited to their substance use. So be careful with that term. Just a little mini lecture on denial.